I think it's the case that most reasonable people would conclude that if we're not going to have a single-payer healthcare system in the short term, then the least we could do as a country is ensure that children have health insurance, right? I think most people, even those who are against Medicare for All, would agree with that premise. But Congress, in deciding to not reauthorize the Children's Health Insurance Program, they're now jeopardizing the healthcare of 8.9 million children. So as you all know, this is a program that has to be reauthorized every couple of years, depending on how long they approve it for, and it just expired. Congress couldn't get their shit together to reauthorize CHIP. Unbelievable. So Aaron Dooley of ABC News reports, last reauthorized in 2015, CHIP is a partnership between the federal government and states that insures American children from low and moderate income families. And though the program situation isn't yet dire and won't be until the states begin to run out of money, some states are starting to get nervous about paying for the program. States are optimistic that Congress will actually act. They're not totally panicked yet, said Diane Rowland, Executive Vice President of Kaiser Family Foundation, but they need to know very soon that additional money will be coming so they'll know how they can continue their programs. Now, when this bill was signed into law by then President Bill Clinton, the uninsured rate among children was almost 14%, but as of 2015, with 8.9 children covered, that rate dropped to less than 5%. I mean, so to say that CHIP is a success is a massive understatement. That brought healthcare to millions of children in this country, and now it's jeopardized. So more on CHIP. So eligibility rules vary by state, but in most states, children under the age of 18 and younger qualify if their family's income falls under the 200% of the federal poverty line, just under $50,000 for a family of 4. Some states also offer coverage to the children in families earning 250 or even 300% of the poverty line. 20 states offer coverage for pregnant women as well. Benefits also vary by state, but coverage generally includes routine checkups, immunizations, mental health services, prescriptions, inpatient and outpatient hospital care, and x-ray and lab services. And with a price tag of $13.6 billion, this is actually a relatively affordable program. I mean, it's well worth the price, right? Considering Congress just voted to approve a $700 billion Pentagon budget. So, I mean, if we can approve of $700 billion for the military, then certainly we can approve of a bill that doesn't even cost $14 billion for children, right? And since CHIP only provides matching funds to states, Congress's failure to reauthorize the program doesn't necessarily mean that all these kids will, in fact, lose their health insurance. Hopefully Congress does come through, but it does mean that states may change the eligibility rules and offer less benefits, or they may have to cut funding from other programs such as education or healthcare from senior citizens, just for example. So it's really frustrating that Congress can easily pull $700 billion out from the budget for the military, but they can't pull out $14 billion for children and to ensure that they have health insurance. I mean, what kind of a morally bankrupt country do we live in to where we prioritize military spending over spending for health insurance for children? I mean, we prioritize death and destruction over healthcare for children. That's sick. That's reprehensible. Congress has got to act. I mean, they wonder why people hate them. I mean, currently Congress has, I believe, a 16% approval rating. I wonder why that's the case. It's almost as if they are not representing us, and they're only there to represent special interests and the military-industrial complex. You can't just allow families to wonder what's going to happen to their children's health insurance. Again, these are kids. They're the future of this country. You have to let them know. You can't just let their lives hang in the balance. And out of all the things that Congress does, I mean, this is truly bipartisan legislation. So if you can't even get something as simple as this done, making sure that more children are covered, then I don't know what Congress is good for. And look, when Hillary Clinton, back in the early 1990s, before she was bought off by the health insurance industry, she actually lobbied the hardest for this particular program. This is her achievement. This is her, I think, signature accomplishment of her life. I mean, this is one of the best things she did. This is what she got when she was unable to pass a single-payer healthcare system. So, I mean, she should be fighting for this. The Democratic Party should be yelling, and screaming about this. But, I mean, really, CHIP, it kind of died with nobody even noticing. How is the mainstream media not talking about this? If you don't support this, I don't know what to say about you. You lack humanity. You lack empathy. You're a bad person. So Congress, get your shit together. Reauthorize CHIP. Because this is something that shouldn't even be debatable. Of course we want children in this country to have health insurance. What are we doing? Jesus.
Support this podcast by becoming a patron at patreon.com/Humanist Report.